I'm Hamish Rutherford from NZME. We're here for HealthCentral ChalkTalks. Today we're talking about the future of New Zealand's healthcare, how we achieve a more productive, sustainable and equitable healthcare system. I'm joined by Professor Gregor Coster, Dean of the Faculty of Health, Victoria University. Gregor, is there any sort of simple solutions to the problems in the healthcare sector?
Well, as we know from the report of the Health and Disability Review, there are some very successful DHBs and we have got a very good health system in New Zealand, but there are some challenges. In terms of a single bullet to kind of fix all of New Zealand's health system challenges, no, there isn't a single bullet. We've got things that we can do in providing better leadership across the sector, better leadership in DHBs, improving management skills. We can do a lot working with our senior doctors and our nurses and all the other health professionals. So not a single thing is the bullet, but plenty of opportunity to do better.
Sure. When we think about the better performing DHBs and the less well performing DHBs, what are the main problems? Is it just a shortage of resources or a difficulty of attracting staff, or is it a wider leadership issue?
Well, there's a couple of issues. The first is that the health system has not funded up the DHB sufficiently, and that's led to deficits that have increased in the last couple of years, and so that's a key issue that needs exploring. The DHBs that do well are those that have got good leadership, where they've got good relationships with the senior doctors and the nurses, and where teams pull together under excellent leadership.
Sure. Has been quite well publicised. We've got $1 billion of deficits across the DHB system. Is that just a sign simply of poor funding or of deeper problems?
I think it is actually a funding issue. We know that at the end of June of this year, the DHBs had a deficit of $532 million across all of the DHBs, and they were all in deficit. But you add into that another $600 million of wage round increases that are coming. We do have a health system that's seriously underfunded, and I hope that government will address this.
You've seen the report that came out in September. Are you hopeful of what will come out of the final report?
It's an interesting report. It's 312 pages long. It makes a great read. It's a very good summary of where the health system is at. I think they understand the issues. The real challenge for the review will be figuring out what recommendations they're going to put forward to government. And then, of course, the ministry and the government will have to sit down together and decide what things are achievable within available funding. So yes, great report. I hope something good comes out of it.